Good evening, doctors. So, this is day 4 of the ECG Decoded series. Today's goal is bundle blocks and MI. So, every OPD emergency doctor should know them. Okay, and if you know them, you can save a lot of lives. So, what is a bundle branch block? As I told you, that heart's electricity flow from SA node to AV node and like this. So these are the two wires in which heart electricity flow to the ventricles. Okay. Now imagine if any of this wire gets blocked. So that side will receive the impulse late. Okay. So if any of the one wire gets blocked, that side of ventricle will get activated late. Therefore, one of the ventricle will contract first and the second one will contract later on. Simple. Now, as you all know, I have told it a lot of times that atria's contraction is seen as P wave in the ECG and ventricle's contraction is seen as the QRS complex on the ECG. Okay, so QRS on a ECG shows both the ventricles contracting together. Okay, now what if one ventricle contract before the other? As I told you in the case of block, so the QRS will get widened obviously because one of the ventricle will contract first and the other one will contract after some time. Okay, so the QRS complex which shows the ventricle contraction, it will get broadened, the time will increase. Okay, and it is seen as M and W wave in the ECG. And where? In just the V1 and V6. So this is the trick for today. William Marrow. Okay, as you can see, this is the left bundle. Okay, and this is the right wire. So if the left bundle gets blocked, it is called left bundle branch block. So in the lead V1, the QRS complex will appear like a W, and in the lead V6, the QRS complex will appear like M. And through this LL, you can remember that this is for left bundle branch block. Okay, let's see the example. So this is a normal QRS complex in lead V1 and lead V6. Okay, now in the case of this left bundle branch block, as I told you with the mnemonic William, you can see that the QRS complex is of W shape. Okay. And in lead V6, you can see that the QRS complex is of M shape. This W and M in lead V1 and V6, this is a case of left bundle branch block. And similarly, see this right bundle branch block. You can see M here and W here, just the reverse pattern. Call it Marrow. Okay, so if you see Marrow, the M in the QRS complex of V1 and W in the QRS complex of V6, this is a case of right bundle branch block. As simple as that. Now you can easily tell a patient that you are having a right bundle branch block or left bundle branch block just by looking at the lead V1 and V6. So doctors, let me summarize these blocks in very short to you in just these two lines. Okay, you just have to see V1 and V6 in the ECG. Okay, in the case of left bundle branch block, V1 QRS will appear W and in V6 QRS will appear like a M. In the case of right bundle branch block, the QRS will appear like a M in V1 and it will appear like a W in the case of V6. So now you can easily tell a person if she is having blocks in their heart. Okay, heart blocks. Now the second topic for today. It is MI localization. MI is heart attack. Part 2 of this video. Now you will tell that a person is having heart attack or not. Okay, in just 5 minutes seeing a ECG. This is a normal ECG and this is a ST elevation. This shows heart attack. Okay, also known as MI. So see, this is a P wave, Q, R S T. Now there is ST elevation in the case of ST elevation MI. So now you can see that this S wave, this is going up from here. Just look at this ECG. Okay. Now from today onward, you will go confidently into any emergency room in any OPD. You will see this pattern, this ST elevation in all the leads of the ECG, and then you will tell that this patient is having inferior wall MI, anterior wall MI, and then the remaining lateral wall MI. Okay, so first mark this. This is lateral wall. It will make your life easy. And after that, whatever is remaining, this is inferior wall and this is anterior wall. As simple as that. From now on, you can diagnose a MI on the ECG very easily. Okay. So to know about the heart attack, you have to first check the ST elevation, and after that which part of the heart is suffering. So for all those who want to know the exact leads and want to remember them, this is the formula for them, ISOL. Okay, just write it down like this. Write inferior wall, septal, anterior, lateral wall. Okay, and you can remember the respective leads like this. Otherwise, you know this pattern that I have taught you. There is one more trick if you want to remember for inferior wall MI. Look at this word inferior. Okay. So just imagine this as 2. This is in the lead 2. These are 3 lines. So this is for lead 3. And this F is for ABF. So now you can easily remember it anywhere. Just imagine inferior wall MI, lead 2, lead 3, AVF. Okay. Now combining the video 3 and video 4, if you see a wide QRS complex, it means a block. As I told you, you just have to check lead V1 and V6 and you will know which block. Is it left bundle branch block or it is right bundle branch block with the formula William-Marrow. Okay, now if you see a ST elevation in any lead, you will now use the ISOL formula to pinpoint which wall is having MI. Or otherwise, you can use the visual cue that I just told you. Visual memory is the best form of memory. So now you have learned 2 superpowers today. Just these 2 can make you lifesaver in any OPD or any emergency. Okay. Look, ECG or any skill, it is not tough. They are made to appear tough by sadists because they want to show that they are the superior. Always stack information one by one. If you try to stack a lot of data, like for example, if in this video I told you that the MI types, ST elevation, TN inversion, reciprocal changes, what are the types, STEMI, NSTEMI, unstable angina, then what is the arterial supply, then what is STEMI equivalence. Okay, so you would have gotten confused. So this is not the right approach. First of all, you have to learn basics, then you should move forward. Okay, so this is it for today. So you have to do something for me today. This is your homework. You have to prepare one ECG with wide QRS complex and you have to identify whether it is a right bundle branch block or a left bundle branch block. Then you have to see a ECG with ST changes and you have to tell me which territory of the heart is having that heart attack. So 2 things, heart attack and blocks. You are good to go.